Good day, everyone across North America. This is John Garmendi with Sony's Professional Display Solutions of America, welcoming you to another in our series of Tech Tuesday webinars. As you know, we created these Tech Tuesday webinars so that our customers, end users, channel partners, and consultants can stay informed and up to date on the latest Sony products and solutions. And today we have a very special Tech Tuesday webinar where we're going to talk about a unique solution that we call spatial reality display. It's something that we've presented here in the past, but today's webinar, we're going to focus on healthcare and how spatial reality display is helping to change the healthcare industry. And we'll talk about some specific applications in the healthcare vertical. As with all of our Tech Tuesday webinars, any websites or any resources that we refer to we'll drop the links in our chat and you'll be able to access them there. Also, this is a recorded Tech Tuesday. So please, as you have in the past, submit any questions that you might have via the in event question panel, but we won't be answering in real time. Don't worry, we will, however, be getting back to you, all of you, by email. So please send us your questions. We welcome them. And with that, I'd like to turn it over to our moderator, Sony's head of XR business development, Thaisa Yamamura. And I'll say goodbye for now, and we'll see you on the next Tech Tuesday. Have a great webinar.
Thanks, John. I'm excited to moderate this Tech Tuesday panel, focusing on how Sony's spatial reality display is changing the healthcare industry. In this session, I'm bringing some industry leaders to present and discuss this topic with me. I'm Thaisa Yamamura, and with me I have today Chris Feldman, Spatial Reality Display Manager for Sony's Professional Displays, Tom Morrow, CTO of Singular Health, Edwin Rivera, Managing Partner at CG1, and David Karaski, Business Development for Sony's Healthcare Industry. Before we start the discussions, let me ask each panelist to give an overview of their role and experience. Chris, can I start with you?
Thank you, Thaisa. Great to be here today. Hope everyone enjoys this Tech Tuesday. Just a little bit about myself. I have about 30 years in commercial AV, and I'm very grateful to be the marketing manager for the SRD display, helping to bring that to market.
Perfect. We're welcome you, Chris. Thank you so much for joining. Next, I would like to ask Tom Morrow to introduce yourself.
Yeah, thank you. Yeah, so I'm Thomas Prowl. I'm the CTO at Singular Health. I've got about 15 years experience in VR, AR development and about 7 or 8 years in the medical field. And I've been working in the VR medical field for about 6, 7 years as well.
Thanks, Tom. Great to have you as well. So next, Edwin Rivera.
Thank you, Thaisa. Hi, my name is Edwin Rivera. I am the managing partner for CG1 Solutions. We're an XR specializing firm. I have over 15 years of experience in the XR field, and we consult in regards to the commercialization and use of XR technologies. Excited to be here.
Thanks, Edwin. Great. So next we have David Karaski.
Hi, David Karaski. I'm a business development manager with Sony. Been with Sony for 14 years, about 40 years in healthcare, and we bring a lot of medical products for the healthcare field, and excited to bring the SRD as one of them for this use.
Perfect. Thank you so much, David. All right. So to start, let me ask Chris to walk us through what is a spatial reality display, well known as SRD.
Sure, no problem. So to begin with, asking what is the spatial reality display? To put it simply, it's a fully commercial grade, glasses-free 3D display that's ideal for upgrading your imaging experience. And we offer it in two different sizes. We offer the SR1 in 15.6 inch and the SR2 and 27-inch size.
Perfect. Thanks, Chris. We see some of the 3D displays already available in the market. Can you walk us through what is unique about Sony's spatial reality display? How can it deliver a very high quality, high 3D quality? What is behind the screen?
So looking at the display itself, we have a few unique features, right? So we're going to start with, we have a high-speed vision sensor that actually supports multiple users now. So we have an update that's coming that will allow you to actually switch between users that are viewing the display. So we're no longer locked into a single user now for that 3D viewing experience. It's a 4K UHD display with high contrast and brightness, full 10-bit color depth, as well as a built-in speaker to support audio. We have a built-in micro-optical lens that allows for the glassesless 3D viewing. Or with a push of a button, you can actually switch to standard 2D viewing for viewers that are more sensitive to it. So it's far more intuitive, and it's built around the user in mind. On the 27-inch, we actually have a VESA mount compatibility, so you're able to either use the included desktop stands or mount it to a bracket or mount it to a desktop mount if you prefer, giving you more options to get it to work in your area. This is a fully commercial-grade display, and that's one thing that does set us apart from a lot of our competitors. So this is built around the idea that this is something that's going to be utilized for a number of hours in the field. So if you want to have something that you can rely on, it's actually built with those standards in mind. And it produces real-time rendering, as a real-time rendering algorithm that helps generate the content that actually follows the user's line of sight. So as the user would actually change position, when they lean forward or tilt back or lean left or right, that content will actually change in real time and create a much more intuitive user experience for a technology such as this, but without having cumbersome glasses or anything else built on top of that.
Perfect. Thanks, Chris. We see a lot of use cases for this type of displays. Can you walk us through what are the top use cases that you see the industry using it, and why in the healthcare?
So with the use cases for the display, there's a number of really powerful applications that we can utilize it within. First is 3D scan viewing. So there's a lot of technology that is out there that allows you to not only scan a space, but it allows you to scan, objects and even, things like a patient's teeth or, a particular type of environment. The display is actually, ideally suited to show that image content or that rendering of that scanned image. So it can be, shown in real time, to the doctor, to the patient, to whoever's, part of the consultation. So we work with a lot of FDA certified software for diagnostic imaging. So this is something that supplements imaging software that you're already using and just really kind of creates that next level up in being able to provide patient care. This is ideal for medical education. In medical education, trying to get experience to the medical professionals that are learning is important. And so being able to give them the ability to actually view objects or view patients or view, content in 3D is going to be helpful to them, when you're dealing with, either a rendering, a scan, or something along those lines. And finishing up with, it's really designed to be outside the ER imaging support for doctors and for patient consultation. Outside the the operating room where you would have a consult or something along those lines. It's really going to be an ideal product there to support your efforts. And here's a short video to go into a little more detail.
Perfect. Thanks, Chris. So I would like to ask Tom, what is Singular Health and what is the 3D Dicon? How does it work with SRD?
Yeah, thank you. Yeah, so 3 Diacom itself was sort of spawned out of the need to improve patient education and improve the collaboration that's happening between practitioners and end of the day patients as well. We felt there's a real need in the market where they're not quite being educated enough, or there's more they can do to improve their outcomes and improve their sort of general understanding of what's actually happening to them or inside their body themselves. So 3DICOM itself is a FDA cleared collaborative cross-platform 3D DICOM viewer, essentially. So we take that standard CT, MRI, medical imaging, those 2D slices, and render them in real time up to a full 3D model of the patient-specific anatomy. So there's no cloud rendering, there's nothing like it's all done locally on a device, and it's all secure and stored locally. The product from day one has also been developed with physicians and surgeons and radiologists in mind and put very first. So we've worked closely with them over the past sort of 6 years developing the software to ensure that all the critical tools that they're used to and that they use day in, day out are inside the software and working with it and work as they expected as well. And the 3D nature of the software lends itself really nicely to Sony's SRD platform, where you can actually render these 3D models in stereo without the requirement for glasses or the overhead of VR, which we've always sort of seen as a pain point when trying to enter the healthcare market, especially.
Yeah, and what do you see as the main features that the physicians are using on the 3D Dicon?
Yeah, so a few of the main features that we have is, of course, as mentioned before, we have the instant sort of high fidelity volume rendering that we provide to people. So we're fully cross-platform, so we work on Windows, Mac, iOS, and Android, and we provide instantaneous 3D rendering of scans. So there's no waiting. You can simply load up any standard Diacom format and render it in real time on the platform. This has seen great uptake and a massive reduction in the sort of cognitive complexity required for surgeons to comprehend and understand 2D images when they have the full 3D platform there right in front of them. And another big thing that was spawned, especially out of the recent pandemic, has been effortless sharing and collaboration between hospitals. So we remove the need to have that DVD USB with it being given to a patient, which they inevitably lose it, to shifting everything to a cloud-based system. So a patient or a doctor can simply share their medical files online, send them via email, and anyone with access to the 3DICOM on that email can simply retrieve the patient images anywhere in the world within a matter of seconds, all through secure online, we've called it medical file transfer protocols. And the other really powerful features we see surgeons using quite a lot has been the real-time collaboration platform as well. So we've gone a step above screen sharing. So this allows for up to 200 people, if you're teaching a class, for example, to all join in the same 3DICOM session together. And they can all see the data on their own screens. They can all manipulate the data together, ask questions, view 3D models and scans and annotations, and all work in a real-time sort of collaborative environment with voice and chat. And again, it's also cross-platform as well.
Wow, so 200 people can use it in the same time. That's awesome. What do you think in terms of how if a physician has the access to the 3D Dicon, how they can connect to the SRD?
Yeah, so with 3DICOM, we've made connection to the SRD as seamless as possible. If the machine detects there's a SRD plugged into it, 3DICOM will automatically start up the SRD screen and load itself onto that screen as well. So there's no requirements for the end users or for the clinician to do anything at all between it. If you have a screen, 3DICOM will automatically migrate across, load in the data, and then start viewing the 3D stereo display instantaneously.
Perfect. So if a user is already a 3D Dicon subscriber, they can get the spatial reality display and plugging into the Windows PC that it's running, and they will be able to have this 3D visualization.
Exactly, yeah. So there's no need for the users to do anything at all to use it, as if they have a 3DICOM license and SRD, they're already set and ready to go.
Perfect. And they can also do this real-time collaboration, having a 3D visualization on the SRD as well.
Yes, absolutely. So the collaborative side of 3DICOM is also supported inside of the SRD as well. And it doesn't matter if one user has an SRD and one user doesn't have an SRD, they'll still work perfectly together at the same time.
Perfect. Thank you. And is there any new features that are coming up soon that you're able to tell us?
Yeah, absolutely. So some of the sort of really exciting features we're coming up is the introduction to side-by-side rendering. So we can have multiple scans loaded next to each other at different times, for example. So a pre and post-op is a very popular sort of combination of scans. That's coming very soon. And another one, we're also introducing cloud-based AI models and ML as well. So you can send a scan to a server, you can run a specific machine learning model on it. One we have currently got in-house is a spinal segmentation. So we can segment all the spine and get it automatically labeled for people. And you can bring that back and view it in the SRD in a full STL 3D model as well.
Wow, that's great. No, thanks for sharing with us. And 3D Icon is already available in the US and Canada.
Yep, so for the USA, our 3DICOM MD has the 510K certification. So they can use in the clinical setting. And we're working on Health Canada and other countries as well at the moment.
All right, perfect. Thank you. So we're going to show a video that showcase a physician using it.
Hello, I'm Dr. Simonin. We have to deal with a broad spectrum of brain and spine diseases. As a neurosurgeon, one of the main challenges is to be able to build a 3D representation from 2D images and also to make the patient understand their disease in 3D anatomy. That's exactly where Singular Health can help me in my daily practice. With 3DICOM software, I can not only see the 3D representation from 2D images, but also with the Sony Spatial reality display, I can offer my patients a hologram effect for more immersive representation.
On voit la tumeur qui est proche ici. Donc.
With 3DICOM software, I can just use the 2D slices like I would normally do and go through the CT scan. Or I can build a 3D representation of a patient scan and use different features of the 3DICOM software in order to show only the muscles, for example, or the bone, so that the patient is able to see a specific region, like a fracture or a brain tumor, and they are also able to see it on a spatial reality display in order to get a more immersive effect. It takes a lot of time and experience to be able to build in our mind a 3D representation from 2D images, and it's very difficult for a patient or a younger colleague to be able to do this process. And that's exactly where 3DICOM helps me, because I may show 2D images, but I may also create a 3D model and also display it on a spatial reality display in order to share the images with colleagues, with the patients, and be able to plan the surgery. For example, for a cervical fracture case, I can better plan my surgery. I can also add measurements and annotations. We can share the same model through a collaborative call with every colleagues in the hospital. Speaking more about the Sony SRD display, it's a good alternative to the usual virtual reality headset because it's quite easy to handle. It's plug and play. You can just take it everywhere, and you don't need to put the headset on the patient's head. Sometimes they struggle if they're not comfortable with it, or wear glasses, or have a nausea effect. The SRD display can afford a very high resolution, and it's just easy to show to the patients in a usual consultation setup. I think the combination of the 3DICOM software and the SRD screen can make a difference, because patients will not have to spend a lot of time understanding where is the right, where is the left of their CT scan. It's very straightforward, and also if they are more involved, the outcome will be better.
Yeah, no, it's a great video. Thanks for sharing, Tom. I would like to ask Edway, based on your experience on the healthcare industry and showing those two solutions to the clients. How do you see your clients using this solution? What is the main benefits for them?
Sure. So if anyone has ever been a part of an enterprise rollout for a healthcare system with XR technologies, you'll know that there's usually a maybe small, maybe large, but there's always a contingent of folks that are concerned about headsets. They don't want to wear headsets. Um, and what we found with the SRD is that that eliminates a huge obstacle in our rolling out this product. And the way where we're seeing this product being rolled out, obviously, is with the surgery departments. We've had a lot of traction with pediatric hospitals, specialists, specialists who are dealing with really complex cases. The visualization that is they're able to accomplish, and the segmentation is without a doubt uh, one of the biggest advantages of adopting this type of technology and this type of monitor. So that just right out of the gate is a step forward, or an advantage rather, in using this type of display.
Perfect. And what do you think it would be the main features that the physicians will be using with the display, or are you already using with the display?
Definitely segmentation. They feel like instead of putting on a VR headset, or seeing something in a traditional um, piece of software, they're able to do segmentation much easier using the SRD. That is without a doubt one of the biggest points we're hearing back from surgeons. And then, of course, patient education.
Mhm.
They love the fact that they don't have to mess with a VR set for the patient to get that 3D feel. The fact that, as you saw in the video, that physician being able to just to turn the monitor and share that with a patient is really priceless, and it's helping them. We're getting the feedback we're getting is, hey, our patients are feeling a lot more comfortable about these procedures. You know, they're complex procedures. It's helping us educate the patient, and obviously a higher patient satisfaction rate. So that's a big one.
Yes, thank you, Edwin. I would like to transition to David Karaski. Based on your experience in the healthcare industry, how they are reacting to the SRD device?
Thanks, Stacey. Yeah, they're overwhelmingly thrilled with the SRD device. In my experience in taking this around and doing the demonstrations and at trade shows, we are getting positive feedback on the use case for the SRD. And for example, with 3DICOM of showing their software on this at other facilities, they are really excited about it. So taking the MRIs and the CT scans, we've had physicians also call in their radiologists to bring in their patients' scans and wanted to see them live on there, and how quickly it was to be able to bring these scans up and visualize it on the SRD, that they even brought in other physicians to come and take a look at this. So this is going to be huge for the medical healthcare field, and its use cases for this also is that we still see 3D being prevalent in healthcare. May not be able to find it much in the consumer world, but in healthcare, glassless 3D that this SRD can present is great for robotics. They use 3D that we're finding in microscopy, in neurology, used for ophthalmology, for heads up surgery. All of them do record in 3D, and being able to play back this 3D content on the SRD and being able to view it without the glasses is also going to be quite huge. What we're also seeing too is that the angle of this, there's a high sense camera that's on the SRD that captures the viewer's head, and with the backlighting on this, the surgeon can sit comfortably in a chair, being able to view the SRD from pretty much any angle in front of it, and it'll follow them, it'll track them, and they'll almost get that feel where they want to be able to go around and look behind it, which is awesome. They can control all this with the mouse and be able to manipulate the image, but having that holographic depth field is really exciting to them. And then another great feature that the SRD offers is an open SDK. And what we see from larger institutions that have their own software development team on site have already started thinking about different kind of software that they want to develop for use for healthcare for this device. So there's great things to come.
Perfect. No, super, super excited. What do you think are the main features the industry is excited about with today's solution? And what are the things that you're working on that it's coming next?
Yeah, and taking this out to like the trade shows that we've shown is that there are a lot of VR companies out there with medical software for use with the VR headsets. And a lot of them limited themselves to the headsets alone. But what we found in showing this with them, and we've taken it to their facilities, and with the Open SDK, they're able to convert this so that their software will work on the SRD. So it opens up for the use case for the surgeons to be able to use this for patient education, for resident training, and be able to give an option to those physicians who may not want to wear or feel encumbered by wearing a VR headset. And they have a perfect solution with the SRD. So we're finding that this is a great broadening of opportunity in the healthcare market with the VR modalities that are out there. So other applications that we're seeing is also in robotics. So we're testing the waters, as it were, and we're finding a lot of interest in this field as well. So we're seeing that we may have some new opportunities in the near future for robotics.
And I see you're showing the picture here with the Visa mount. And I know this is one of the features we added to the SRD specifically for the healthcare industry. We got the feedback, and a lot of them were requesting from the first generation. So the second generation, Sony was able to implement that. So it's good. So based on your experience on the healthcare industry, I know you are working, Sony is huge on this industry. Can you tell us what are the products you are working on this field?
Sure. Sony, surprisingly, has been in the healthcare market for over 40 years. We sell through a lot of OEMs and resellers, and you'll see a lot of Sony products that are labeled Sony, and some of them are private labeled. So the different various products that we have available that's out there are medical graded displays, various sizes, and they range from different resolutions of 2D, 3D, HD, 4K capabilities that's used in a wide variety of specialties in the operating room. Printing is also still very huge. You would think these days that digital would be the way to go, but there is still a large requirement for hard copy printing. So Sony is one of the market leaders of medical graded printers for healthcare. We also have digital recording that also takes in 2D, 3D, HD, 4K capabilities. And we also try to bring in other sides of Sony as well, different verticals such as the broadcast, where we utilize pan-tilt zoom cameras in the operating room, or we also build out their conference rooms with Bravia displays or projection that's used also for doing grand rounds for hospitals or discussing patients' requirements.
Yeah, no, that's awesome. That's a full solution. Within the products that you're working, is there a specific one that works with SRD?
Yep. Well, with SRD, we're using a new product that's come to market. It's called Nucleus. And with Nucleus, what that allows is video routing over IP. And that allows us to take any medical imaging, any source. It's very agnostic to anybody's camera or visual, whether it's any OEM's camera, ultrasound, or patient vitals, and we can route that information to any display that's in the operating room. Nucleus expands being on the hospital network, being able to take that information from the operating room and transport that out of the operating room to another hospital on the campus or around the world. And how it would relate with the SRD is that being on the hospital's network, if they needed to view the patient's MRI or CT scan, they would be able to call that up immediately in the operating room and be able to view on the SRD the patient scans and be able to review that. Again, they can be in an outer chamber in a patient's room and be able to bring that up to go over a patient's diagnosis with them, with their family members, or again with resident training in a conference room to be able to bring that up all through Nucleus.
Perfect. No, looking forward to see that solution. So is the SRD already available for physicians to buy, where they can get more information about it?
Sure. So, the SRD is immediately available. We are ready to go out and demo this to anybody who wants to. All they have to do is go onto the Sony website and punch in for the SRD and look that up. And in that web page, you will find in the lower level, contact us. Clicking on that contact us link, they can put in their information and somebody from Sony will contact them to set up a demonstration.
Perfect. No, and I encourage people to register and request for a demo, because 3D display, you have to really see it to believe. It's hard to explain the benefit on a 2D screen. So yeah, thank you so much for this very useful information. We will be sharing all the links in the chat here. As John mentioned, anyone that has any questions, feel free to post them on the chat. We will be sharing a couple useful links for your reference from what the topics we discussed today. And thank you very much for all the panelists and everyone who joined us today.